everybody, welcome to this week's video full of lots of tips and advice for anybody who's got an outpatient nursing interview coming up. So I hope you find this video useful and I wish you all the best in your interview. So I'm going to go through some key areas, how to structure your background research that will help you prepare for interview questions. I'll go through what to expect during your interview, how to prepare for interview questions with some example questions, and also learning from feedback. So you should always start with background research when you're preparing for an interview, and I always suggest that you do this systematically. So the first thing is to establish what type of interview you've been invited to. Is it a virtual outpatient interview or a straightforward face-to-face panel interview? Will you have some paper-based exercises to complete? Do you need to prepare a presentation or some group work? And it's quite unlikely for junior roles or early career roles that you need to prepare a presentation, but for senior roles often you do. So check the invite letter or the email which should detail this. Is it straightforward panel of interviewers who are going to ask you questions, or does it include a value-based interview where you need to prepare core practical examples? And I'll talk about value-based interviews later. So then you can prepare your interview information and your planning around the invite letter. So for example, where you're going to conduct your virtual interview, because if it's a virtual interview, you need to have a good online connection and a quiet room, for example. Another thing you need to think about is the role and the outpatient service that you're specifically what it entails. So all managers want to know is the reasons why you've chosen their specific outpatient area and service, and they expect you to know about their outpatient service. So what does the role entail? How will you meet the needs of these specific patients? So for example, if it's an ophthalmology outpatient, where you might have patients that have got vision, well, you will have patients that have got visual impairment, or if it's a stroke clinic where you have patients who might have difficulties communicating or with mobility. And I'll talk through some interview questions relating to areas in outpatients later. So how are you going to do your background research on this? Well, you can review the job description, you can drill down on keywords, roles and responsibilities in the role, and there will be details of the service in that job description. So you really need to understand the service that you've applied for. You can also book an informal visit where you contact the manager on email, you have a walk around the outpatient area. If you can't do that and it's quite a distance to travel, you might book a virtual meeting instead and have a chat through with the clinical educators or the manager about that area. During the informal visit, or if you have a chat on the phone, you can ask about the role. You can ask about key aspects of the service, the patient's needs and priorities, or any challenges currently in the service. How is this outpatients run? And all of that information can help you in interview for preparing questions. You should also research the employer website, NHS values, as you may be asked questions about the employer or NHS values, or how your values align with their values. And you can get that information online on local employer and NHS department websites. So if you've looked at what's going on in the hospital trust, the key vision, the employer mission statement, for example, you can also mention that as part of an answer to a question, or when you're applying to a particular employer on a personal statement even. So for more senior posts, some employers request a presentation or group exercise as part of the interview. It's very unlikely you'll get this if you're an early career nurse. You should be told about it before the interview, and if you are, I've got 2 videos, they're free on my YouTube channel, that can help you prepare. So other areas you can research and prepare for interviews include key healthcare terms and definitions. So for example, terms linked to compassionate care, team working, leadership, quality improvement, clinical governance, risk management, audit, evidence-based practice, or health promotion and health education. It really depends on the type of outpatients you're applying for. And previously I suggested you review the job descriptions and person specification, and you're going to find some key headings and terms in there too. And you really need to understand what those key terms mean in case you're asked a question about them in interview, because you might go blank or not answer the question as well if you're not quite sure about the term. And I've seen that where someone was asked, about what's your view of compassionate care, how do you ensure that your practice is evidence-based, and they just went blank, and they really did know the answer, but they hadn't revised those terms beforehand, so it's helpful to do that. We also have local national standards, policies, frameworks, guidance that are important to revise and have a look at. So we've got NICE guidelines, standards for waiting times, escalation pathways, medication, complaints policies, incident reporting, mental capacity assessment in case you're asked about the capacity to consent, deprivation of liberty safeguards. So for example, you might be asked what to do if someone declines medication or a test in clinic. Or states that they're not going to adhere to the advice that's been given. So doing this background research helps you in case you're asked scenario-based questions. And if this is a senior nurse role, you need to know about any national standards for specific conditions and key performance indicators for that particular service. So for example, we have screening and testing key performance indicators and waiting time indicators for outpatient services. So I've also got several videos on my YouTube channel to help you prepare for some key terms that might be used in interviews, such as quality improvement, risk management, incident reporting, clinical audit or nurse education. And you might be also asked about what your objectives are going forward in the role. So I've got a video on how to write objectives or say what they are, and the difference between an aim and an objective. So do check them out. They're all free on my YouTube channel. And if you're going for a specific leadership role or education role, I've got specific playlists on those areas and they're all free. So I hope you find them helpful. So having reviewed your background research, it's important to prepare some core case examples for any value-based interview questions, or your examples can be used to add depth to face-to-face technical interview. And you might have one example that links to lots of these areas, but it's good to think about some of these areas. If you're a student, you can review past placement feedback, course assignments, case study reflections, your dissertation, and they might ask you to demonstrate an example of compassionate care or team working, or a care that was provided which had an evidence base, that was informed by an evidence base, or that how you promote quality standards in your care. So looking at evidence-based practice, standards of care and research example, quality improvement and risk management, especially if you're applying for more senior posts. They tend to be the questions more for senior posts, but you might be asked about quality care. Team working and positive collaboration, so something where you've positively collaborated in a team that went well. Leadership, organisation, management, something you've led in practice, something you've organised or managed. Education, staff support, so how you've supported and educated other staff, patients. It could be a poster presentation that you've done if you're a student, for example. And dealing with a challenging situation that you've learnt from as well. And if you're going for senior post, people management, staff performance, so an example where you've de-escalated a situation or you've dealt with conflict in practice, it's good to have an example there as well. So other areas for background research, any outpatient role involves delegation to other staff. So it's helpful to understand support worker roles and responsibilities and the differences between roles. For example, a support worker versus an assistant practitioner or nursing associate role. So you need to think about key members of the team that you're going to be working with in this outpatient service. So if it's a rehabilitation outpatient, you might be working with physios, occupational therapists, well you will be, and speech and language therapists, for example. So it's helpful to think about those roles and responsibilities across the team and service. Also think about current hot topics and read some journal papers or in the news or in the media in case you're asked about a current topic or how you keep up to date. So what was your last journal paper that you read, for example? So if you're unsure of the differences between support worker roles, I have a YouTube video that explains the differences, and also if you go on an informal visit or book a virtual meeting with the team before the interview, you can ask about how those roles are utilised in outpatients. So just a few real quick tips on preparing for the interview day. Obviously check travel times, get to the location on time if it's a face-to-face interview. Lots of interviews are online nowadays. Check your internet connection is strong, there's no disturbances, that the room is tidy behind you, that you've got nobody walking in, and you can blur the background if it's virtual. You can often book a quiet room where you work or in a university if you don't have a quiet room at home or don't have a good connection. I would always recommend not using your mobile phone if you've got a desktop computer or a tablet, because what you're wanting to do is make sure the screen is fixed and stable, that you can see your face, not your forehead, or no face at all. But you don't want to be holding the device while you're trying to concentrate on your answers. So you need to have a stable screen. So if you do use a phone, it needs to be fixed in a position. so you're not holding it with your hand. Cancel as soon as possible after the interview if you cannot attend. Employers are not obliged to offer you another interview, but most will give you an alternative day if you cancel as soon as possible before the interview. So before we focus on some interview questions, I thought it would be helpful just to explain what a value-based interview is. Value-based interviews aim to select interviewees who align most closely to the values required in the role and linked to the service. It could be the values of the service, the employer, organisation, or NHS values. It's dependent on the employer as to which values they're using in that interview. They usually start with a generic type question, such as talk me through an example where you've provided compassionate care. Could you give me an example where you provided quality care, or you led a project, you promoted quality in your role, quality practice in your role. And once you've described your example, the interviewers are then going to drill down and ask you more questions about that scenario, depending on what you say. So you could be asked, for example, would you have done anything, on reflection, would you have done anything differently if this situation happened again, as an example question. There's some key tips for value-based interviews. Firstly, choose an example that relates to you and not about somebody else, somebody that you've observed delivering compassionate care or somebody that you've observed leading a project. It's about you, what you did, what impact you made. So without specific detail, your answer is also going to be scored low. So it's important to prepare good examples beforehand so you've got something to talk about. And don't just talk generically about the topic area. You're demonstrating your practical example, application and the impact you made. So don't make your example up, because you need to recall when the interviewers drill down with more specific questions. That's going to be very difficult if it's not a real example. So a few generic questions to prepare for. You're going to usually be asked questions along the line of why have you applied for this outpatient role? What led you to apply? Tell me what you know about this outpatient service, or what key skills are required in the role? What values do you have? Why should we offer you this opportunity above other candidates? That final question really is more for senior roles because they're competitive, and that's where you've got to sort of sell yourself. But essentially with any of those sort of initial questions, the interviewers wanting to know that you understand the role, that you're talking about your development and any transferable skills, and you're selling yourself, but you're also being you. Give some of you, anything that you're passionate about, that you're hardworking, reliable, that you've got some what your key strengths are, to make you relatable as well. But it's helpful to structure the answer to that before you attend interview. If you have gone on informal visits, if you've looked on websites, bring that into your answer. It's fantastic to say, that you've looked into the service and what you think is really good about that service as well, because it shows you've done some background research. So before I look at more specific outpatient type questions, just the more generic questions that you could be asked in any interview really, but looking at your strengths and weaknesses, what challenges do you envisage working in this outpatient? And if it's a newly registered post, you can say that you are developing your delegation and prioritising skills, and if that could be, but that you will ask for help. You need to understand what the outpatient service is about and their priorities for delivery are, which would help you with this question, but the types of patients that might be coming to that outpatient services, to be able to answer what challenges there are. But tell me about time when you overcame a challenge. It could be any challenge. How do you manage your work-life balance, or what strategies do you use to deal with stress? They're seeing if you can cope with workload. And they may ask you questions about prioritising, delegating, with the numbers of patients that might come into outpatients and what you do, and think about how you can draw on. So it's helpful to think about how you can draw on past experiences where you've managed caseloads and the strategies that you used. If you're newly registered, they might want to know that you're going to ask for help when needed, that you are systematic and that you are organised. And another question might be, where do you see yourself in 5 years' time? So in outpatient interviews, sometimes you're asked about questions about quality care, evaluation of care, and care delivery. So give me an example where you've delivered compassionate care or an improvement, you've made a difference to a patient, you've provided evidence-based care. How do you know when you've delivered quality care, or how do you evaluate your own care? And so you need to know what these key terms are, as I mentioned earlier. keep it in simple, and think about how we evaluate care through patient feedback, just talking verbally, communicating, listening, observing patients. Often patients, nurses, when they get asked how you evaluate care, think it's some in-depth academic answer. We evaluate care through our communication, interpersonal skills. We also evaluate care through patient feedback, through questionnaires. And it might be, if you're going for a leadership role, it might be about evaluating care and quality in the outpatient service as a whole. And that relates to patient and carer, family feedback. We have patient surveys, friends and family surveys. We've got thank you cards, emails. It's all feedback on the quality of the service. We also use audits. We analyse incidents and rises in complaints. And that links to the evaluation of care. Government waiting times is a big one in outpatient. So we've got these nice frameworks, national service frameworks, key performance indicators linked to services and specific patients' conditions. So again, they are ways to evaluate the quality of the care and the service. You might be asked about, tell me a time when you positively influence care through teamwork. For a more senior role, it might be about promoting collaboration across a whole team, delivering quality outpatient services, and linking to more leadership type questions. But there's usually some questions there about the delivery of the service and the quality or evaluation of care somewhere. Just to say, if you are applying for more senior positions, you'll have questions relating to leadership, organisation, management in outpatients, and you might find some of my video playlists helpful on leadership, quality improvement. So do check them out. They're all free on my YouTube channel. So some example questions about support, training or education. So for early career nurses, how to keep yourself up to date. Give an example where you supported a member of staff or a patient and how this impacted on them. Give an example where you've educated others in your role. And think you come across patients, staff, support workers, family members, administrators. It can be any example. What would your 3 main objectives be when you first start in the role? So you need to know what an objective is. How would you support a staff member who told you they were struggling, or an underperforming staff member? And that would be for a more senior role. How would you ensure the learning needs of the team are met, again at a more senior role? And again, for senior roles, how you would promote compliance with statutory mandatory training. What strategies would you implement to retain staff in your team? These are all sort of example type questions under support, training and education. So a few scenario-based questions you might get in any role really, but they link to national policies and standards such as medication administration, escalation and safeguarding, the what would you do if questions. So for example, these sorts of questions, it's helpful to revise safety policies, risk assessments, escalation policies and systematic assessments. What would you do if you found controlled drugs missing from a drug cupboard, for example? You're adhering to medication policies, procedures, escalation. A patient slips on a recently mopped floor in outpatients and hits their heads. What would you do? So obviously you're thinking about the safety of that person. Head injury requires an ABCDE physical assessment to make sure they haven't got a subdural hematoma. They might need to have a scan. Doctor needs to assess to ensure that they're safe. Obviously an incident form, etc. A patient wishes to make a complaint about the way they were spoken to by a doctor in the consultation room. What would you do? So, and often they're not often, but there may be questions about complaints and what happened, what you do. So assessing the situation by finding more information. Is the doctor just offering national guidance that the person didn't agree with, or has there been a serious altercation? So we're needing to get a bit more information. But essentially you're looking at talking through dealing with complaints, the complaints procedure, recording, reporting, and delivering some actions there. You notice that a lady's being prodded by her partner in the sexual health clinic room. Her partner says the lady is his wife and cannot speak English, and he will speak to her. He'll speak for her. What do you do? So again, it's assessing and communicating using your interpersonal skills, but ensuring safeguarding here. It may link to a safeguarding issue. So you're wanting to communicate with this lady without a husband to ensure that she's okay. You might be requesting a translator rather than the husband translating. It may link to potential safeguarding issues which needs further escalation, and we have safeguarding leads. So you're looking at the procedure for safeguarding and escalation and translation services. So as I said, for these sort of questions, do revise those policies and procedures. We also have scenario-based questions linked to communication. For example, communication difficulties, or a patient refuses prescribed care. So some example questions: how would you support a patient who cannot speak English, or a patient who has visual hearing impairment in the outpatient department? Looking at local policies and strategies to promote communication, translation services, or what support is available for someone with a visual or hearing impairment. A patient may become anxious about an outpatient surgical procedure and says they can't go through with it. What would you do? Or you may have a person who is alcohol dependent who refuses to take medication or health education advice. And it's about open, compassionate communication, interpersonal skills, listening to them, explaining, reassuring. If they have capacity, you cannot make or coerce a person. To think about the answers to these sort of questions. A patient starts shouting at the receptionist on the desk that she's been waiting for over an hour. What would you do? Again, it's using communication skills to de-escalate the situation and manage conflict, but keeping calm and professional, letting them know the reasons for the delays and when they're likely to be seen, moving them to a quiet room to talk if they're upsetting other patients, and they might want to register a complaint, so talk to the patient advice and liaison service, the PALS team, and they can be directed according to complaints procedures. Another question: one of the support workers informs you that she knows a patient in the waiting room and feels uncomfortable being in their presence. What do you do? So think about assessing the whole situation and delegation, your management skills, so the support worker can be potentially moved until this patient has been seen in outpatients. But think about how you potentially would answer some of these questions underpinned by key policies and procedures. We have scenario-based questions linked to organisational management skills. So for example, the clinic's running behind by an hour, what do you do? And this answer is demonstrating your organisational leadership skills, prioritising and communication skills, how you organise staffing and the logistics managing patient cases, which is dependent on the service and the particular role. How do you communicate to patients in the waiting room about delays, for example? A patient's hospital transport is delayed by 4 hours. The patient's paraplegic and in a wheelchair, what would you do? So if you have safety concerns of the patient being sitting, you would have concerns of a patient sitting too long that's paraplegic, risk of pressure sores, skin damage. So what you're going to think about: could they reside in a discharge lounge or a ward where the patient can be on an air mattress or bed or a trolley where it's safer to wait and they can be turned? Can you get admin staff to liaise with transport? So think about how you would answer that sort of question. A consultant informs you that this is more for a leadership role, but a consultant informs you that he wants to extend all Tuesday clinics by 3 hours in a week's time. He wants to start this in a week's time. What would you do in your role as manager in outpatients? So lots of things to unpick there. Evaluating and assessing the decision, the rationale behind the decision. Does the senior leadership team know about this decision? Are they going to reduce clinics on another day? So is it a viable or feasible option? For example, if you ran a clinic, if this clinic just runs on Tuesday morning, it may be feasible to extend it for 3 hours. But if you're running the clinic till 5, you might not have the current staffing levels to support that request. So you'd have to escalate to senior team. Do they know about this request? There may be financial implications. But it may be essential to meet waiting time targets that this clinic does run for the extra 3 hours. So it's all about collaboration and finding out more about this situation. But think about how you might answer that question. So ideally you're going to get this role, but if you're not offered the role, especially if it's a senior post, learn from your feedback. Make sure you request verbal feedback. Most employers are not obliged to offer written feedback, but they should offer verbal. Sometimes staff are not given much feedback and they're just told by interviews you didn't score as high as the other candidate, and that doesn't give you enough. So don't be frightened to ask specific questions. Ask them thank you for your feedback, but which were my weaker answers? Which were my stronger answers? Which answers could I have improved? They're not going to tell you what you should have said, but they'll give you an indication of answers that maybe lacked a little depth, and which areas you need to specifically work on. And then you can reflect on that interview feedback, and it will inform your future interview preparation. It's helpful to book a mock interview if you are successively not getting into, not getting roles. Do try and book an informal interview. You might also want to check out some of my other videos on my channel to support personal statements and interview preparation. So do check them out, they're all free. So good luck with all your interviews. I wish you every success. If you have any questions at all, put them in the YouTube questions. You can DM me on Twitter privately if you prefer not to put them on a public forum. And do check out my books. I have a book on how to prepare for interviews and develop your career as a nurse or midwife, and that goes right up to sort of band 8 level. So I hope you found the talk helpful today.